So, obstetric complication of preeclampsia. So, for the obstetric complication of preeclampsia, you need to know that what the first obstetric complication. Generally, the obstetric complication in preeclampsia is divided. Every time you have obstetric complication, you must divide into maternal and fetal. So those are the two major divisions that you have in obstetric complication. So for the maternal obstetric complication, the first one that you can have is a case of a postpartum hemorrhage. Is it clear? You need to know that preeclampsia is a risk factor of postpartum hemorrhage. Is it clear? Now, the second complication you can have seen in maternal, you have placental abruptio. Is it clear? You have placental abruptio that you can have in a patient. The third complication you can have in a patient, say obstetric so to the mother. So generally, those are the you have apart from that, you have those other complications that we said. But generally, those are the two major complications. You can have also complication of obstetric complication in the mother can also be eclampsia. Is it clear? So you have postpartum hemorrhage because that hypertensive disease can result to a profuse bleeding of the arteries. Is it clear? You can have postpartum hemorrhage, somebody that has preeclampsia. You can have placenta abruptio in somebody that has preeclampsia. You can have eclampsia in somebody that has preeclampsia, another complication. And then the fourth complication, you have herpes syndrome. Is it clear? So the two major complications that you can have maternal related are mostly these two, eclampsia and herpes syndrome. Is it clear? So eclampsia just means that you have convulsion in pregnancy. So when you have convulsion in pregnancy, it's eclampsia, as I've just explained. Now, what is herpes syndrome? Herpes syndrome is a syndrome of you have hemolysis plus elevated liver enzymes plus low platelets. Is it clear? Now you need to know that what generally I like putting this herpes syndrome under the pathophysiology of the thrombotic microangiopathy that I've explained in the latter tutorial. Is it clear? So I've explained thrombotic microangiopathy. Is it clear? So you need to know that this herpes syndrome is generally based on this thrombotic microangiopathy. Is it clear? So on the thrombotic microangiopathy, because of the high blood pressure, there is going to be endothelial injury, and that endothelial injury is going to result to an increase in platelet consumption. So when you have an increase in platelet consumption, in order to occlude those endothelial injury because of the high blood pressure, is going to result to a low platelets. Is it in blood? Now the next thing is that what, since it's going to be occlusion of the artery as a result of the platelets, you are now going to have collisions of the red blood cells to that occluded blood vessel, which is going to result to intravascular hemolysis. Is it clear? Now when there's intravascular hemolysis, there's going to be a release of hemoglobin. Is it clear? Now hemoglobin has both injury to the kidney and also injury to the liver. That's why hemoglobin is generally not released directly in the blood vessels. The method by which you can release heme in blood is via bilirubin in order to prevent injuries to the cells. So now this hemoglobin that is going to be boosted is going to, as a result of intravascular hemolysis, is now going to result to liver damage, which is going to result to an elevated liver enzyme. Is it clear? And now the next thing also, after elevated liver enzyme, we have also when this product occurs, so we have also elevated liver enzymes. Is it clear? So those are the different elements that you need to visualize. Now there's also another element that I like to put when we are talking about the herpes syndrome. I also like to put the HERP. There's a U which is also needed to be added when you have to visualize for herpes syndrome. Is it clear? So uric acid. Uric acid is an element that also helps to determine the severity of preeclampsia and also the mortality rate of the fetus. Is it clear? It can also tell you the severity of preeclampsia and the mortality rate of the fetus. And this uric acid is still produced by the same mechanism. Is it clear? You need to know that what when we are going to have much hemoglobin, needs to have we have also the first part is the heme. The heme part is the one that results to injury to the liver, that results to elevated liver enzyme. The second part is the globin. Now you need to know that what when the proteins are broken down, proteins have the component of the NH2, the amine group, and that amine group is going to be broken down to produce uric acid via the xanthine oxidase pathway, basically, and this uric acid can be elevated to enter in all these syndromes. So though the syndrome is HELP syndrome, I like to put it HELP syndrome because it's a complete pattern to show the severity of preeclampsia. Are you understanding? Now the next element now is going to be the fetal complications. What are the fetal complications that you need to know? The fetal complication that we have, the first one is going to be the fetal well-being when you have an acute fetal distress. Is it clear? So what are the elements on the history and the physical examination that can tell you that there's acute fetal distress? On the history, you can have the cardiac count to 10, or you can have the volus count. Is it clear? On the history. So on the history, when you have the cardiac count to 10, what are the elements? On cardiac count to 10, you need to do that one. Here you just ask the woman to count the beats, the fetal movement in 12 hours. Is it clear? If the fetal movement in 12 hours is more than 10, means that it's normal. That's the cardiac count to 10. But if the fetal movement is less than 10 within 12 hours, is abnormal. It's a sign of acute fetal distress on the history. The volus count, you count in 24 hours and you have to attain at least 30 counts. You have 30 fetal movement in 24 hours. That's for the volus count. Is it clear? Now the next thing, you can have an intrauterine growth restriction. Is it clear? In case of preeclampsia, you can have an intrauterine growth restriction in the case of an intrauterine growth restriction in the case of a fetal complication of preeclampsia. Is it clear? So those are the different complications, and you can have also an intrauterine growth death. Generally, intrauterine growth death in history can be visualized by intrauterine growth restriction can be visualized by small simple height for gestational age. If you have small simple height for gestational age, it can be an element that can tell you that there is intrauterine growth restriction. Is it clear? And you also measure the Boost formula. You estimate the fetal weight of the child to know if there is actually intrauterine growth restriction. On physical examination, you estimate the fetal weight of the child by the Boost formula or the McDonald formula that you have visualized in the tutorial of labor. Is it clear? Now the intrauterine growth restriction, how do you for intrauterine growth demise or intrauterine fetal demise, to visualize that, you just have on the history absent fetal movement. When you have absent fetal movement directly on the history, you can know that it's intrauterine fetal demise. Or still from the history and physical examination, you have no fetal heart rate. Is it clear? Can tell you that there is intrauterine fetal demise. For also the acute fetal distress, I forgot to speak about the physical examination that you have to visualize acute fetal distress. Is it clear? For the physical examination, acute fetal distress that you need to visualize, you need to assess for the fetal heart rate. Is it clear? And you're going to have a fetal tachycardia or a fetal bradycardia, and you have also the variability and all those other elements that I've also spoken about in acute fetal distress. The sign that you can have, you have already lactation. In acute intrauterine fetal demise, if a woman suddenly have lactation, is it clear? So the breast milk is coming out, it means that it's a sign of intrauterine fetal demise. When you have absent fetal movement, you have breast milk is coming out, and you have also absent fetal heart rate. All those are signs of intrauterine fetal demise. Is it clear? So those are the different elements that you need to visualize when you want to see the complication of preeclampsia. Now, after visualizing all this, we now go down to the next part of our tutorial.